perception that it is an old person's disease, but that is not the case. It can affect much younger people.
Well, it can affect younger generation, but the majority of cases is among the elderly. Only, for example, like 10% of people over 65 have dementia, but it affects like 1 in 4 over the age of 80. So that why, although it is more common, but few people, they can develop dementia even under the age of 60 as well.
So, George, in your journey with dementia, because you've studied it and you're working towards treatments, what have you seen that has been exciting in the last couple of decades?
Well, I'll tell you what. Probably I have been talking about the exciting thing over the last 2 decades, but I am going to talk tomorrow about the more exciting thing over the last year. What I have, even my attitude to the diagnosis and treatment of dementia is changing too.
Right.
Just like to reflect over the last 20 years how our research showed a treatable form of dementia called normal pressure hydrocephalus, which results from buildup fluid in the brain, is more common in people with memory problem dementia and account for 15% of cases. Considering that most people think it's rare, account only for 1 to 2% of dementia. And we have shown putting shunt in the cavity of the brain can improve the physical and mental well-being of patients and enable them to live independently at home. Now, we have published all that result, but how my practice has changed over the last year? Well, because I believe in the future, well, we might have like combined therapy for dementia. And that's developed from my treating my patient. For example, one case, I saw the patient about 5 years ago. She was 77. And she came to me because she has memory problem, balance problem, and incontinence. And then we found out she has a buildup fluid of the brain. She had a shunt inserted, and she was living normal life. Until beginning of this year, I had like a referral to say her memory has deteriorated. And in fact, the memory had declined, let's say, from 29 to 21 out of 30 on memory score. So I looked at her and said, well, she's declining now. So I thought about using a drug which we use in Alzheimer's disease.
Right.
Basically, it improves the chemical of the brain called acetylcholine and stopping it from breaking down. And most studies showed it can slow down the deterioration. But what I found in this patient, her memory got much better.
So it didn't just slow it down, it improved it.
To the degree that her score increased from 21 to 29 out of 30. Which showed me perhaps this might be the future. You know how for ischemic heart disease we have multiple therapy.
Yes.
So we have got we can put a stent.
Yes.
We can treat the cholesterol. We treat high blood pressure. We can give blood vessel drug to dilate blood vessel. I think might be the future in treating of dementia by having variety of drugs as well as a shunt might be in appropriate cases.
And so you've seen the success in this patient of yours. Can that be obviously the big thing is, can that be replicated in much larger numbers?
Well, that's what I believe. I have already another patient, a man this time, who had the treatment and responded so well. And I feel in the future we have to take the structure of the cavities of the brain, and they might benefit from shunt if they are enlarged. Then we consider therapy, for example, improve the chemical of the brain. And now you heard this year about this breakthrough about immunotherapy, a drug that is combined with the amyloid, which is abnormal protein, which is toxic to brain cell, and clear it from the brain. I think that's also encouraging. So imagine if we have all these alternative drugs, which I believe it can help us to improve the people who are experiencing dementia.
Gosh, I like the sound of that. a drug that will actually clear that fluid from the brain, which we've understood for some time now to be at the heart of the problem.
Absolutely.
So you put all of those therapies together, and you would be looking at potentially a much improved outcome for people for a much longer period of their life.
Absolutely. And I think I learned my message from my patients. We can live until we are 90 without any physical and mental problem. And because we know that how they live their life by staying active and never slow down as well.
You never slow down, Dr. George Raze. You never slow down. Now, I know you're going to be doing a bit of a lecture tomorrow at the LGH at 1 o'clock in the lecture theatre. Can people come along and listen to what you have to say?
Absolutely. That's why I'm grateful to Launceston General Hospital for supporting and organising this event, which will be at 1 o'clock at Lecture Theatre, and it's open for the public. And we are going to have also live online if people can't come, if they can connect through their computer as well.
Right. So it's going to be broadcast online.
Right.
And you'll be able to go along live in the flesh tomorrow.
Thank you.
And it is actually World Alzheimer's Day today.
Yes, that's right. How about that?
What are you going to do to mark the day?
Well, later this afternoon I will be in the council meeting, so I might talk a little bit about it as well. And tomorrow I'm going to give my talk, so I feel excited about trying to help people and change the stigma toward dementia and make our community dementia friendly.
Good stuff. That's what we need. Dr. George Raze, thank you for coming in and having a chat this morning.
Thank you so much.
All the best with the lecture tomorrow 1 o'clock at the LGH in the Lecture Theatre. It is 5 minutes to 8, and we're going to catch up with Evan Wallace from our newsroom, brand new to ABC Northern Tasmania. Evan, good morning.
Good morning to you, Belinda.